Another start to fall, another influx in COVID-19 cases, just because 'tis the season, right? And the federal government is taking note.
So starting today, you can get free COVID tests shipped directly to your home. The website covidtest.gov is relaunching, and you can order up to 4 tests per household.
Yeah, and to dig a little bit deeper into today's news, we're joined live by the medical director of infection prevention at Mount Sinai West, Dr. Chrissy Woods. Dr. Woods, thanks for joining us. I'm going to launch right in. We can order new ones, but I have a stack of COVID tests already in my cabinet, some of which are expired. Can we still use those? Can we recycle them, or do we just toss them out?
I think many of us are in the same boat, and that's definitely a question I've gotten a lot. So the general rule of thumb is that there's a little control panel on your test. So there's a C and a T on most of the tests that you see. That C appearing when you take the test is going to let you know whether or not the test is working. So regardless of what the expiration date is, I always tell everyone to take a look and make sure that that line does show up. So if you're not sure when you're taking the test, make sure that you're looking for that C. In addition to that, there is a website through the FDA that actually you can look up each individual test that you have at home. There are so many different types. There are a lot of different companies that make the test. So if you go in there and you plug in the specifics of your test, you'll find out whether or not it's still any good. Most of the tests had an 18-month expiration date on them that has now been extended to 24. Again, that's sort of a general rule of thumb, but if you want to know for sure, you can look at the FDA website. Actually, there's a good link to it from the covidtest.gov website. So check there and then always look for the little C on your test.
Nice. So it seems like you kind of have a little bit more time if you do have some of those tests at home. One more question for you, or maybe a few more depending on our time. Wanted to ask you about the COVID booster, the new one. From as young as 6 months and older, you can get the new booster, but it's hit a bunch of snafus, people not being able to get their insurance approved, not being able to get an appointment to get the vaccine. And some people are just under the impression that, you know what, I've already had COVID, I think I'm good to go. Talk about the importance of trying to get over those hurdles to get that booster shot.
Absolutely. So we'd like to think of it as more of an annual test as opposed to, or an annual vaccine as opposed to a booster. We're really moving away from that thought process to being something more similar to the flu vaccine, which most people do go ahead and get every year. And we want to sort of think of it in a similar vein when it comes to our COVID vaccine. There have been a lot of roadblocks to it only because it's gone from being a government-funded vaccine to now going over to insurances, and certainly we've had a lot of patients also who are looking for it. It is important to make sure that you're up to date with this. Right. It's particularly important for people who have any underlying conditions, for anyone who's pregnant or elderly or immunocompromised. And as we know, immunocompromised can really span across all age groups, so it's not really necessarily age specific. Having had COVID before, depending on when you had it, you may not necessarily have the same protection against the strain that's currently circulating. And we do know that the annual vaccine that's out now that has just been approved is actually very well matched to the circulating strain that's going around now. It doesn't mean that you're not going to get it. I think we've all sort of understood that, unfortunately, that's not what the vaccine is going to do, but it is making measurable differences in keeping people out of the hospital and keeping people from dying or from having long COVID, which is also another really serious sequela.
Well, good reminder, good advice. Dr. Chrissy Woods, thank you for your time.
Thank you.